the government rightly needs to ensure that we have a health service that can provide care in a timely manner. At the moment, the waits that patients are suffering, and what I see every day as a GP are unacceptable. And in fact, the NHS is not delivering on its objective to provide comprehensive, accessible care. So, in fact, the announcement and what it wants to achieve is absolutely fine. However, I do think that the announcement made yesterday will only make a very small difference in relative terms to the scale of waits that are currently being endured by patients in the NHS. By the government's own admission, these proposals are about trying to create some efficiencies in terms of not wasting hospital appointments and also moving more investigations and treatments into community diagnostic centres. Now, this is estimated by the government to only make a difference of 6% in terms of improvements in long waiting times. The real problem we have is that we're facing a backlog of 7.5 million patients currently on waiting lists. Those patients aren't being addressed by this initiative, which is really for prospective referrals. And those patients are coming to my practice every day, asking, can their care be expedited? When will they be seen? And that's actually not been addressed in these announcements. And I think the other thing to say is that the announcement hasn't actually described the detail of how this will be operationalized. We have at the moment a health service which is woefully short of healthcare staff. We have around 50,000 fewer doctors in the UK compared to many European counterparts. And you can't have clinicians in two places at once. So if you're really going to be expanding care into new centres, they need to be staffed. And none of that was described in the announcement yesterday. So in summary, what I think is important is that the government is making this an absolute priority. I think the nation needs to hold the government to account. But what's missing is the how.